Okay, so get this. We're diving into some really cool research today. Imagine a blood test that could tell you if you're at risk for cancer like years before any symptoms even show up. That's what this whole early cancer detection thing is all about. And it's getting closer than you might think. We've got a podcast episode from Health Horizons to set the scene, and then we're going deep with a scientific article from Nature Communications that's packed with details. Buckle up because we're about to unpack how scientists are using proteins and genetics to potentially revolutionize how we detect and even prevent cancer.
It really is fascinating research, especially when you consider how much potential it has to change lives.
Totally. Most people have heard of cancer biomarkers like PSA for prostate cancer.
Yeah,
That's a protein found in the blood, right? It's one tiny piece of the puzzle that can tell us a lot.
that's right. And what's really exciting is that scientists can now analyze thousands of proteins at once, not just one or two. It's like upgrading from a basic magnifying glass to a high-powered microscope, giving us a much more detailed picture of what's happening inside the body.
So you're saying we can look at a whole bunch of proteins that haven't even been connected to cancer before. That's a lot of potential clues.
Absolutely. Many of these proteins might turn out to be totally unrelated to cancer, but there's a good chance that some of them will hold valuable information about early signs of the disease.
Okay, let's get to this study. I know they looked at a ton of data, right?
They did. This research used data from the UK Biobank, which is this massive project, tracking the health of hundreds of thousands of people. It gave them access to blood samples and health records from over 44,000 individuals, allowing them to investigate links between 1,463 proteins and 19 different types of cancer.
Whoa, 19 different cancers. That's a pretty big deal.
It is. And remember, they were looking at protein levels up to 7 years before someone was actually diagnosed with cancer. That means they can potentially see changes happening long before the disease became detectable through traditional methods.
7 years is a lot of time. That could really change someone's outlook. Catching cancer early must dramatically improve the odds of successful treatment, wouldn't you say?
Exactly. And not only that, but it also gives people more time to make lifestyle changes or explore preventative options.
So they found a bunch of proteins that were linked to cancer, but just finding a connection doesn't mean that protein is causing the cancer, right? What if something else is going on?
That's a really important point, and it's where genetics comes into play. You see, our genes actually influence the levels of proteins in our blood.
Okay, so our genes are kind of like the instruction manual for our bodies, and they determine how much of each protein we produce. So how does that help us figure out which proteins are actually involved in cancer?
Well, by analyzing someone's genes, researchers can determine if a protein is truly linked to cancer risk, or if it's just a bystander. There are these specific genetic variations called cis-pQTLs. Think of them like fingerprints that point directly to the proteins involved in cancer development. They give scientists a much more reliable way to connect the dots.
Got it. So genetics helps us weed out the false leads and zero in on the proteins that really matter. Did this study use any other genetic analysis?
They did. In addition to looking at those individual cis-pQTLs, they also used a broader approach called an exome-wide genetic score, or XGS for short. Imagine it like this. Instead of looking at a single fingerprint, they're analyzing the entire handprint to get a more comprehensive picture of the genetic factors influencing a particular protein.
Okay, so they're using genetics to double check what they're seeing in the protein data. What happens when both analyses point to the same conclusion?
That's when it gets really interesting. When both the protein analysis and the genetic analysis point to the same protein, it's like having two independent witnesses confirming the same story. It gives us a much higher level of confidence that we're on the right track.
So how many proteins passed that test the ones with the double confirmation from both protein and genetic analysis?
They found 4 proteins that showed strong links to cancer in both the observational study and both genetic analyses. 2 of them, CD74 and TNFR-SF1B, were strongly linked to non-Hodgkin lymphoma. Another protein, IDMA, showed a strong connection to leukemia. And finally, there was SFTPA2, which stood out for its link to lung cancer.
Okay, so out of over 1,400 proteins, these 4 are the superstars. The ones with the most compelling evidence linking them to cancer risk. What does this mean for people like you and me? Can we expect to see these proteins used in cancer screening tests anytime soon?
It's definitely promising, but it's important to remember that this is still early-stage research. More studies are needed to confirm these findings and to figure out how to translate this knowledge into actual screening tests. But imagine a future where a simple blood test could screen for multiple cancers years before symptoms even appear.
That would be a game changer. Instead of waiting for symptoms to show up, You could be proactive and catch cancer in its earliest stages when treatment is most effective. Early detection is key, right?
Exactly. And not only that, but it also gives people more time to make lifestyle changes or explore preventative options, which could significantly reduce that stress.
And it could also lead to more personalized treatment plans, right? If you know someone has a higher risk for a specific type of cancer, you can tailor their treatment accordingly. But what about the other proteins they identified? The ones that didn't have that super strong genetic validation, are they just useless data points?
Not at all. Even if they don't directly cause cancer, those proteins could still provide valuable clues about the biological processes happening in the body that might lead to cancer. They might be indicators of inflammation, for example, or changes in cell growth.
So it's not just about finding that one smoking gun protein. It's about understanding the whole picture, the complex web of interactions between different proteins and our genes. It sounds like a lot of work.
It is complex, but that's what makes it so fascinating. Remember, they looked at proteins in blood samples taken up to 7 years before a cancer diagnosis. That means they were able to identify potential warning signs long before the disease became clinically detectable.
That's amazing. We're talking about potentially catching cancer before it even has a chance to take hold. But before we get too carried away, this research specifically focused on those 19 common cancers they investigated. Does that mean it doesn't apply to other types of cancer?
You're right to be cautious. This is a significant step forward, but it's not a universal solution. Further research is needed to explore whether these proteins play a role in other types of cancer. But even if it only applies to these 19 cancers, that's still a huge number of people who could potentially benefit from this research.
Absolutely. This could have a major impact on public health. So we've got these powerful new tools to analyze proteins and genetics, and this study has given us a treasure trove of potential clues about early cancer detection. What happens next? Where do we go from here?
That's where it gets even more exciting. This research opens up incredible possibilities for earlier cancer detection, potentially saving countless lives. Imagine a world where a simple blood test could provide you with a personalized risk assessment for various cancers tailored to your unique genetic and biological makeup.
It's like personalized medicine for cancer prevention. Instead of a one-size-fits-all screening approach, you could get a test that tells you exactly what you need to be watching out for. That would be incredible.
Exactly. And if your results indicate a higher risk for certain cancers, your doctor could recommend more frequent screenings or additional tests to keep a close eye on things. It's about empowering individuals with the knowledge they need to make informed decisions about their health.
And not just individuals, but also families. Imagine the peace of mind for someone with a family history of cancer who can finally get a clear picture of their own risk. They could take control of their health and potentially prevent cancer from developing in the first place. But I imagine there are some hurdles to overcome before this technology becomes widely available. It all sounds pretty high-tech. What are some of the challenges?
Well, one of the biggest challenges is cost. These advanced protein analysis techniques are still quite expensive. We need to find ways to make them more affordable and accessible to everyone, not just a select few. We don't want to create a system where only wealthy people can benefit from these advances.
That's a really important point. It needs to be accessible to everyone, regardless of their income or background. What about the accuracy of these tests? How can we be sure they're reliable?
That's another crucial aspect. We need more large-scale studies to validate these findings and make sure these protein-based tests are truly accurate in predicting cancer risk. We don't want people getting false positives and undergoing unnecessary anxiety or invasive procedures.
Right. It needs to be reliable and it needs to be affordable. But even with those challenges, this research is still incredibly promising. It feels like we're on the cusp of a major breakthrough in cancer care. There was one thing in the study that really caught my eye. They found that many of the proteins linked to cancer risk were associated with cancers of the blood, or organs that process blood, like the liver, kidneys, and lungs. Why might that be?
That's a really astute observation, and what's fascinating here is that it highlights the unique nature of blood. It's this dynamic fluid that interacts with virtually every organ in our body. So it makes sense that if there are early signs of cancer in those organs, those signals might show up in the blood as well.
That makes total sense. It's like blood is this communication highway carrying messages from all over the body, and these proteins are the little messengers that can tip us off to trouble brewing.
Exactly. And it also suggests that blood-based screening might be particularly effective for detecting these types of cancers. Of course, more research is needed to confirm this, but it's a promising avenue for future investigation.
Okay, so we're starting to understand why blood might be such a valuable tool for early cancer detection, but this study also looked at something else I found really intriguing. They analyzed how the associations between these proteins and cancer risk changed over time, sometimes up to 7 years before diagnosis. What can we learn from looking at these long-term trends?
That's where we start to see the real power of early detection. Remember those 107 proteins that were still associated with cancer 7 or more years before diagnosis? That's a huge window of opportunity for intervention.
It's like having a sneak peek into your future health. Not a full picture, but enough to see if there might be some trouble brewing down the road.
Exactly. By tracking these protein levels over time, we can see if they're trending in a direction that might indicate an increased risk for cancer. And if they are, we can take steps to address those risks before the disease even develops.
So it's not just about a single snapshot in time. It's about monitoring these proteins over the long term to see how they're changing. That's where the real predictive power lies.
Precisely. And this could lead to a whole new approach to preventative health care. Instead of just reacting to disease after it's already taken hold, we could be proactively managing our health based on these early warning signs.
Imagine that a world where we're not just treating cancer, but preventing it altogether. It would be a complete shift in how we think about healthcare. This whole deep dive has been mind-blowing. We've gone from the basics of proteins and genetics to the cutting edge of cancer detection research, exploring how scientists are using these powerful tools to potentially revolutionize the way we approach cancer care. It's truly inspiring to see science pushing the boundaries of what's possible.
It is, isn't it? And it's important to remember that this is just the beginning. As technology continues to advance and our understanding of cancer biology deepens, we can expect to see even more groundbreaking discoveries in the years to come.
It makes you wonder what the future holds. Where does all this leave us? What's the big takeaway for our listeners? If this research is still in its early stages, what can they do today to protect their health and potentially reduce their risk for cancer?
That's a great question. While we don't have all the answers yet, there are certainly things you can do today to be proactive about your health. First and foremost, talk to your doctor about your personal risk factors for cancer. This includes things like family history, lifestyle choices, and any pre-existing health conditions. Your doctor can help you assess your individual risk and recommend appropriate screening measures.
So it's all about having that open communication with your healthcare provider. They can help guide you based on your unique situation.
Exactly. And of course, maintaining a healthy lifestyle is always a good idea. Eating a balanced diet, getting regular exercise, and avoiding smoking and excessive alcohol consumption can all go a long way in reducing your overall cancer risk.
Those are the classics for a reason. It's about taking care of your body from the inside out.
And finally, stay informed about the latest advancements in cancer research. There's so much exciting work being done, and new discoveries are emerging all the time. By staying up to date, you can make informed decisions about your health and potentially benefit from these breakthroughs.
I love that. Stay curious, stay informed, and stay empowered. It's about being an active participant in your own health journey. And on that note, we'll leave you with one final thought to ponder. Imagine a world where a blood test could tell you your risk for various cancers years in advance. What would you do with that information? Would you change your lifestyle? Seek out additional screenings? Explore preventative measures? It's something to think about. This deep dive has given us a glimpse into the incredible potential of early cancer detection, and it's clear that the future of cancer care is filled with hope and possibility.
Absolutely. It's an exciting time to be alive, and I have no doubt that we'll continue to make incredible strides in the fight against cancer.
Until next time, stay curious, stay healthy, and keep diving deep.